Any parent with young children can tell you all about ear infections, and the most common surgery with anesthesia done on young children is the insertion of ear tubes to drain that excess fluid that often causes them. But mounting concerns about anesthesia in children so young has prompted many doctors to search for alternatives. And here to tell us more is WSJ health reporter Sumathi Reddy. Sumathi, great to see you. Thanks for being here.
Thanks for having me.
So first, tell us a little bit about the surgery, what it does, and which children are considered candidates for it.
Very common surgery. It's less than 10 minutes. The doctor cuts a little hole in the eardrum, puts a tiny cylinder-like device in, and that basically clears the problem. So it's kind of
it drains up excess fluid, right?
Yeah. So it helps with the drainage, which prevents sort of the buildup of like all that gunk and like bacteria that causes ear infections.
And now anesthesia, though, is needed for this surgery.
Yeah, so even though it's relatively low risk, it's only 10 minutes, but you do have to go to the hospital, you have to go to the operating room, you have to sort of fast beforehand and afterwards, and you have to go under general anesthesia. So that's, you know, when you have a kid under the age of 1,
yes,
a little scary.
Yeah, because we're talking about kids here 5 and under, right? That's what we're focusing on.
There are kids who are older who get them, but ear infections in general are more of a problem when you're 1, 2, 3 years old.
And what are some of the problems doctors are finding with the anesthesia in kids so young?
So it's still an open field. There's a lot of ongoing research. They have found that when they're exposed to anesthesia at a very young age, they have some sort of potentially have neurocognitive effects.
Right.
There was a really interesting study last week. It was a small study, 28 kids, but it showed that it doesn't even matter sort of the number of times you're exposed to anesthesia or the duration of the surgery. Any sort of duration, you could have memory problems later.
Oh, that's very scary.
Yeah.
So there's been a new task force, correct, that has drawn up some new guidelines around the surgery?
Yeah, so the first guidelines came out a year ago, and they said that like if you get recurrent ear infections, even if you get 3 in a year or 4 in a year, you have to have fluid build up in your ear at the time of inspection.
Okay, so now they're saying wait it out a little bit more before you jump to the surgery.
Yeah, so there's a lot of watchful waiting.
And are there other alternatives to the surgery that are being tested?
So there's some companies that are looking at devices. One would allow for using like laughing gas, like the kind of stuff you use at the dentist's office.
Right.
And you could potentially maybe one day do it in a doctor's office.
Have those been shown to be effective, or they're still being tested?
They're in clinical trial, like at Mayo Clinic and a few other places in Minnesota.
Right. All right, we can wait and see. Well, Sumathi, thank you so much.